Wonderful, thank you very much. Good morning, folks. My name is Kelly Davison, and I'm here to present about my project, the Gender, Sex, and Sexual Orientation Digital Health Hub Proof of Concept Project. I'm a doctoral candidate at the University of Victoria, and I'm the project lead for this. I received funding from the Digital Research Alliance of Canada, and this was my proposal. So I acknowledge with respect that I'm situated and the University of Victoria is situated on the ancestral territories of the Lekwungen, which is the Songhees and the Esquimalt peoples, as well as the Wasanich peoples, whose historic relationships with the land continue to this day. I also have some acknowledgements in there. And so we know that health inequities in sex and gender diverse people are driven by cis heteronormative institutional bias in healthcare. This includes normative use of a gender binary, of a sex binary, and conflation of sex and gender in digital health information systems. The standards that support digital health information systems are also wrought with this bias, and they interpolate that bias into our healthcare processes. And we see that in inequitable health outcomes. So there's been a lot of work going on in terms of modernizing GSSO, digital health information practices. And so the vision of this project really is to bring together all of the work that the community is doing in a GSSO digital health hub, proof of concept sort of demonstration project. And the idea of this hub is to monitor research and progress with respect to Canada Health Infoway's action plan to modernize GSSO information practices, which we published in 2021. And this is in response to item number 7 of the action plan. The purpose of the hub is to liaise, guide, assist, and monitor the progress of the action plan, and to support people across the country, across North America, across the world, as well as internationally, the standards community, with implementation of modernized digital health information practices. So my learning process. So I live on the west coast of Canada, and so most or all of my sessions were smack dab right in the middle of my working hours. I do have a day job, so it was difficult for me to attend all of the sessions, though I did manage to attend most of them. I attended and participated where I could. The YouTube channel that OLS provides is a wonderful resource. I watched all the videos, the recordings, while trying to keep myself healthy on the treadmill. I had a wonderful mentor, Callie Westerling, who provided a lot of support. And I learned a lot about open, respectful community management from the standard run of show that you folks on the call have. The checklists with the links were very helpful for me because there are a lot of different platforms that we're expected to participate in and log on to. And then learning to use GitHub was a real highlight for me, and unlocking some of that functionality was fun, and I'm looking forward to deepening my skills there. So the sky is the limit when it comes to, I think anyways, using Git to manage open communities. So now that I know the terrain, I can deepen my knowledge through the use and application of these tools. Right now, I'm 95% done this OLS fellowship. I'm preparing my training materials. I've hired project coordinators to support the project. I want to submit my ethics application by the end of the week, and have been working hard on that. We need to announce some training sessions, and that's going to teach people who want to get involved in the community about open science, open tooling, and how we're going to go about developing the community. I'm also going to hold some focus groups, and based on and during those focus groups, we're going to talk about what some lessons learned about how people can use open science, use open tooling, best practices for it. And then I'm going to have some knowledge dissemination sessions with some national nursing organizations that I'm a part of, as well as research groups that I'm a part of, and also the standards community that I'm a part of. So that's all in the works. It's going to happen very soon. But the invitation is for everybody. This is an open community, and gender, sex, and sexual orientation information practices affect us all when we're accessing healthcare. And so I invite you all to be a part of this community. We are a collaborative international community of contributors and standards experts. You can expand your network and your profile. There's some pretty high-profile people who attend these calls. We want to develop inclusive upstream solutions that will cultivate health equity downstream, and we do that through modernizing GSSO information practices. We're going to promote and advance open science. This is going to be based on open science, our approach, and also advance and raise awareness of digital research infrastructure in Canada. So come, help us build this community, and if you want to get involved, you can always email me. So next steps, submit those ethics, develop all the training materials, hold the training sessions, the focus groups, do the webinars, and then continue to develop the hub. So thank you very much. If you have any questions, please email me.